6:40, a study has found almost two-thirds of doctors believe that GP surgeries should be put into A&E departments in order to treat those patients who turn up to hospital not needing emergency care.
Well, they believe it will ease pressure on A&E units. Well, joining us now from Staffordshire is Head of the Royal College of GPs, Dr Helen Stokes-Lampard. Good morning to you and Happy New Year.
Good morning. Happy New Year to you too.
So I had an experience of an A&E recently. My wife gashed her knee while running in the dark, which is further evidence why you shouldn't run in the dark. But what was interesting to me was lots of people pouring in to Chelsea and Westminster in central London. It was like a Friday night, early evening. A lot of people pouring in, and I could see immediately with my untrained eye, a lot of them shouldn't really have been in A&E. They could have been dealt with in a conventional GP situation. So my immediate reaction to this is it seemed like a pretty good idea. My second reaction to it was, where are you going to find all the GPs to be in A&E, given there's already a problem finding GPs? So where do we go with this?
Well, you've hit the nail on the head there. Yes, there are many people who turn up at A&E departments across the country who probably shouldn't be there. Some of them go to A&E in the mistaken belief that they'll get seen more quickly. Some of them go there because they genuinely don't know where else to go for help. And for those people, actually, it would be helpful to have a GP based in the A&E department. And we've got lots of experience in hospitals that have already tried this, and it can work extremely well. And certainly GPs working alongside hospital consultants can be a really good team in terms of sorting patients out in a really efficient way. But you're absolutely right. We've got a serious shortage of GPs throughout the whole of the UK at the moment. We've got funding problems, we've got staffing problems, and the more GPs you put in A&E, the fewer you've got in the communities closer to where the patients live. So whilst intuitively it seems like a great idea, there are problems in it, and it risks confusing patients if you tell them, oh, don't worry, there's a GP in your A&E department. Patients will mistakenly go there thinking they can see a GP, and that's not going to help anything because the records aren't joined up, the continuity of care isn't there, and the rest of the community services like district nursing and health visitors and so on, they're not based in the hospitals either.
So official NHS figures show that 13% of people who go to A&E are discharged without any treatment at all. A further 35% discharged after being given only advice or guidance. I mean, that's a huge proportion, you know, almost half of those who go to A&E don't need to be at A&E. Is there not somebody who could be there who's not a GP, because, as we know, they're under pressure as well, but is some other form of professional who could help those people and relieve the pressure on, you know, the staff trying to give out emergency care?
Well, first of all, those figures can be a little bit misleading. Just because you're discharged without treatment or just given advice, that doesn't mean that you didn't need to get checked out. So not all of those will have been people who shouldn't have gone to A&E in the first place. If you've fallen and sprained your wrist and not sure if you've broken it, it may well be that it was appropriate to go and get it checked out. So the figures can be a bit misleading. But A&E, just like general practice, is staffed with a real mix of healthcare professionals. A&E use a lot of very experienced nurses and nurse practitioners, just as we do in general practice. And they're fantastically good at assessing patients, sorting them out, and much of the care that can be delivered doesn't necessarily need a doctor, doesn't necessarily need a consultant-level doctor in A&E. In general practice, all GPs are consultant-level doctors, i.e. we're not junior doctors. In A&E, many of the doctors that patients see first line are what are called junior doctors, those who haven't yet achieved consultant status, but they're all qualified doctors and well trained. So we're a good team, lots of different professionals working together to deliver care in the best way we can. And we're all supported by physiotherapists and a whole host of other clinicians working alongside. So teamwork is key in both A&E and general practice.
OK. Professor Helen Stokes-Lampard, Chair of the Royal College of GPs, thank you very much indeed. Worth noting that 61% of all the doctors polled about this thought it was a good idea.
I know.
So they're clearly feeling the pressure at their end and think this is a way to alleviate it.